This is video 21, demanding the release of Mumia Abu-Jamal from prison. In this video, I was going to read an excerpt of Mumia's writings from Writing on the Wall. Considering the times of our totally incompetent government and our healthcare system that's just as incompetent, in 2014, October 2014, Mumia wrote a piece about Ebola that I'm going to read. With the death of Mr. Thompson Eric Duncan, shortly after his arrival from Liberia, West Africa, the Ebola crisis has burst onto millions of news screens, generating deep levels of fear and xenophobia. The African term Ebola, named for a river in the Congo following the first known outbreak in 1976, evoked the fears and anxiety of the foreign. But it is a tropical disease best known as hemorrhagic fever. The virus causes internal organ systems to break down and lead to massive bleeding. To be sure, Ebola is a serious health concern, for it has 70% mortality rate. But to beat back the fears, public officials have been playing down the threats posed by the virus, often armed with little more than hope and false confidence. Not much has changed. For politics, often more imaginary than reality, it is a poor barrier against the seriousness of viruses, death, and disease. This isn't about Ebola crisis, it's about the American healthcare system, made possible by a flawed business model that prioritizes profit above all other things, even life itself. Consider this. Mr. Duncan was first entered into Texas Presbyterian Hospital. He was interviewed by a screener, prescribed antibiotics, and sent home. The screener was likely not a medical-trained healthcare professional, but a receptionist, perhaps armed with a checklist to cover. Chances are the worker was among the lowest-paid staff, unless one considers a janitorial work. The business model, one followed by most institutions in America, is now exposed as ineffective, dangerous, and the least health-conscious one possible. That was a business decision driven by the bottom line of money, not life. Similarly, the recent crisis has exposed how vulnerable nurses are in the system, for the business perceives them as less valuable than doctors. Hence, they are paid less, trained less, protected less, and worked more. Who spends more time with ailing patients, doctors or nurses? Who is the closest to physical contact with patients? But according to published accounts, nurses had their necks exposed, and when they complained, they were told to use tape to protect themselves. This is a system that protects profit and prestige, not people. For doctors get the most protection, nurses the least. When this latest Ebola outbreak first struck West Africa, the U.S. mobilized soldiers to go there. Cuba, which has advanced biotechnical medical experience with tropical diseases, sent more than 1,000 doctors to help heal people. Cuba, little socialist Cuba, had sent more than 135 healthcare professionals to 154 countries, more than the UN World Health Organization. Their Latin American medical school in Havana trains thousands of poor medical students from all over the world for free. Not much a business model, but one hell of a human model. In solidarity from death row, this is Mumia Abu-Jamal.